right now we haven't decided which route we're going to go. It's definitely going to change the way we do business.
You're going to have fewer employees working 40 hours a week. You're going to have more of them working 28 hours a week to stay under the limits.
We're probably going to look at possibly closing 1 day a week.
I think that some of the employees that won't be, some of the people that won't be employed anymore are people who are using our industry as to supplement their family income.
Welcome to Public Policy in the Real World. I'm Olga Halaburda for the MacIver Institute. We're joined today by 4 Wisconsin restaurant owners who are here to talk about the impact of the Affordable Care Act, commonly known as ObamaCare, on their individual businesses. But before we jump into the details on how this will affect you, let's step back and let me first ask you, how did you learn what was in the 2,700-page piece of legislation as far as what rules and regulations you'd have to adhere to?
I think we're still learning what we're going to have to do. There's a lot of uncertainty and how it's really going to affect us.
Jay, talk a little bit about waiting for the Supreme Court to make its decision and your interest in digging into this law.
Right. You know, I really thought it was going to be unconstitutional, so I really didn't dig into it a whole lot because I just felt that, you know, how can government force us to purchase something? You know, now that I've dug into it, it's you know, it's like you open this can of worms in this Pandora box, and all of a sudden you've got all these different provisions that are a bit vague, and they're being debated as we speak right now, and there's a lot of uncertainty, and that's hard in business to figure out where you're going to be next year and 5 years from now on a business plan to figure out where these costs are going to end up. So it puts a lot of stress on business owners to try to figure that out.
The restaurant, bar, and tavern industry is the largest private sector employer in Wisconsin. 10% of Wisconsin workers work in a restaurant. First, a show of hands, do any of you provide health care insurance to your workers currently? Pat, why don't I get you to talk a little bit about that?
A few years ago, we had a huge increase in our insurance premiums because we had a small group of less than 30 people. At that point, we were sort of forced to go to a voucher program and to provide a stipend, a monthly stipend to our employees. Then they go and purchase their own insurance.
Yes, currently we provide insurance for our upper management people, and the small group that it is, it's a very hard group to manage, simply because, again, the healthcare costs keep rising.
Our premiums just year after year after year took these 30% increases, and it just got to the point where we couldn't afford it as a business, so we had to drop it.
Okay, now let's get into the weeds of the policy. We'll start with the employer mandate. Any employer with 50 or more full-time equivalent employees must provide health care insurance. The law now defines full-time as 30 hours a week. For those of you who fall into that category, how does that affect your business?
Well, with that mandate, you're going to have a lot of establishments probably keeping the number of hours that they're working somebody down to under 30 hours. Is it practical? No. Is it going to create more work for employers? Yeah.
You're going to not only have a number of people working under 30 hours, but the people that are working full-time, their responsibilities are going to become greater because they're going to be forced to pick up the slack. And it's going to, I think where it's going to affect them is the quality time with their family. You know, where with a structured environment, you can plan family things and things like that. If you're going to be a full-time person, one of the people that we select to be full-time, you're going to have to be flexible to make up when you're short of help, because it's going to happen.
Yeah, I'm kind of right on the edge. I don't know where we're going to fall. We're probably going to look at possibly closing 1 day a week on the days that we don't make money already. So maybe a Sunday afternoon, a Monday where our sales aren't there.
Well, we will be falling under the 50, but I don't believe that number will stay. I think that because businesses will start structuring some of their hours and try to get below that number of 50, they're gonna have to reduce that number down from 50 to eventually 40 or 35 to get more people to participate in the program. And you're just going to see an entire change, I think, not just in restaurants in the way they do business and their hours and how they staff, but in all small and medium-sized businesses. Everything from the guy who works in your car to the person who serves you your food. Things are going to take longer. Places are going to not be open as often. I think that will go all across the board, across the country, not just this industry.
Okay, I gave you some homework. Given the health care insurance for one worker ranges between $7,000 and $10,000, I asked those of you who believe that you'll be affected by the mandate to calculate how much it's going to cost you to comply and provide the insurance to your workers. Bruce?
Well, it cost us about $300,000 a year. And overall, it's going to add about 4%, I believe, to the cost of goods, because I don't think business certainly can absorb a 4% increase in costs.
And if you choose not to, can't afford the health insurance, the law says you have to pay a $2,000 per employee fine or tax. In some cases, it may be as high as $3,000 per employee. Talk about how much paying that tax would cost.
Well, that would be about $120,000 a year.
So that's your choice.
That's the choice. And for that, you get absolutely nothing.
Talk a little bit about that choice and what you're going to decide to do.
We're not sure at this time yet. I do know that we will have to pass the costs along, in either case. So it increases the cost to the general public. I don't think any of us in this business can afford to take a 4% increase in costs.
We're going to end it there for segment 1 of Public Policy in the Real World.